What does the hallucinogenic drug can do to the human body? Many people believe that drug addiction, dependence, and tolerance are all the same thing. However, each term refers to a very different aspect of how drugs affect a person's body and brain. It is critical to understand the distinction. When users build a physical tolerance to a substance, they develop a dependence. If they stop using the medicine completely, they may have withdrawal symptoms. The most common way to overcome a reliance is to gradually reduce the amount of time you consume a certain chemical. Addiction, on the other hand, happens when a person's brain chemistry has been altered as a result of extensive drug or alcohol use. Addictions are uncontrolled impulses to take substances, notwithstanding the harm they do to oneself or others. Treatment is the only way to overcome an addiction.
The hallucinatory effects of the substance kick in roughly 5 minutes after administration, resulting in a profound religious-like experience that lasts about an hour. Individuals who have consumed toad venom have described their experiences as being one with the universe and feeling reborn. One user even stated that, while under the influence, they felt a total fusion with God. Bright colors, moving environments, and recursive patterns are all experienced by users. According to the researchers, the drug causes intense emotional reactions, euphoria, convulsions, and vomiting, as well as leaves users immobile and unresponsive.
Users report feeling an afterglow after the venom wears off, which they believe can inspire them to make substantial positive life changes. 5-MeO-DMT has a placebo-like analgesic effect, similar to hypnosis. The substance has been demonstrated to aid in the breakup of the past trauma attachment, harmful habits, and negative cognitive patterns. Because of this psychological effect, some researchers believe that the venom could be useful in treating anxiety and depression in controlled setting with a well-trained professional. In fact, preliminary research from Johns Hopkins University suggests that it may be just as effective in psychopathy at combating depression and anxiety with much shorter time of recovery.
Alan Davis of Johns Hopkins Psychedelics conducted an online survey of 362 people who regularly use toad venom in ceremonial group settings to investigate the potential medicinal effects of O-methylbufotenin. Respondents said they'd been to sessions with groups of 5 to 12 people, with each ceremony monitored by a sober facilitator who administered the substance. Participants took turns being dosed before sharing their thoughts on the spiritual journeys they each took while tripping in a closing circle at the end of the experience. Around 80% of the 162 people who self-reported having anxiety or depression said their symptoms improved after taking the medicine.
Combination of neurological changes in users, brain and insight gained through the psychedelic experiences. Davis believed the 5-MeO-DMT found in toad venom is effective at treating these mental illnesses. Davis thinks that the research being conducted at Johns Hopkins will encourage others to follow suit and investigate the use of psychedelic as a treatment options. It's worth noting, however, that researchers oppose recreational usage of toad venom, stating that the substance should only be used under medical supervisions. The RSNs are the source of complexity in a variety of complex cognitive function that can be disrupted in mental disorders such as major depression, anxiety disorder, persistent depressive disorder, PTSD, body dysmorphic disorder, eating disorder, and psychoactive substance abuse. The other concept that is frequently mentioned is psychedelic therapy, which refers to the ability of psychedelic at high doses to induce a loss of judgment to time, space, and the dissolution of ego boundaries.
What is DMT? DMT stands for dimethyltryptamine, a molecule that is produced naturally in the brain as well as in Central and South American plants. DMT is a hallucinogenic tryptamine substance that usually comes in the form of a white powder. DMT, while less well known other than psychedelics like LSD or magic mushroom, causes a brief but strong visual and auditory hallucinatory experience. People can smoke DMT with a pipe or brew it into drinks like ayahuasca and yahe to experience its effects. DMT users may also inject the substance, albeit this is a rare occurrence. DMT, often known as Fantasia or Dimitri, is one of the least commonly used medicines in the United States and around the world. The majority of people who try DMT have already tried other hallucinogens. In the United States, DMT is classified as a Schedule I controlled substance, which means that it is unlawful to create, purchase, possess, or distribute the drug. The chemical has a considerable abuse potential, no recognized medicinal value, and no acknowledged safety standards for its usage.
DMT increases the creation of serotonin, a neurotransmitter that makes us feel good. Users of DMT report extreme euphoria, hallucinations, and new perceptions of reality, which many describe as life-changing. When people consume DMT, a trip can start very instantaneously and last less than an hour. After around 30 minutes, users who drink DMT as a brew generally begin to experience hallucinations that last 4 to 6 hours. Mild side effects have been reported by some users, and they can remain for many days. On a physiological level, DMT can have negative consequences. DMT creates brief but powerful visual and auditory hallucinations when smoked, which users have characterized as an alternative realm, otherworldly, or a near-death experience. DMT causes nausea, vomiting, and diarrhea when used orally. The DMT experience can range from exhilarating to terrifying, depending on the particular user. Users may have difficulties absorbing and integrating the trip into their everyday lives since the experience is so profound. The drug's mental adverse effects might last for days or weeks after you have taken it.
DMT, unlike most hallucinogens, does not appear to develop tolerance or physical withdrawal symptoms. As a result, most studies do not believe that DMT is addictive. Furthermore, there is no evidence that long-term DMT use alters or harms a person's brain in any way. When a person uses DMT to escape reality on a regular basis, it can lead to psychological dependence. Some DMT users even regard the drug as a form of therapy, taking it on a regular basis to feel better. DMT can produce psychological reliance despite the lack of evidence that it causes physical dependence. This is especially true for those who take the substance on a daily basis to self-medicate mental health difficulties. When compared to other hallucinogens and stimulant medications, DMT withdrawal effects are mild. Users, on the other hand, may develop significant cravings for the substance and feel psychological discomfort if they are unable to obtain it.
The psychedelic element in magic mushroom psilocybin was discovered to have anti-anxiety and antidepressant properties. The trip from magic mushroom takes 4 to 6 hours, especially if performed in a clinical setting. Toad venom trip is an hour long. Consumers might possibly enjoy the same experience in a shorter time and in a more controlled environment. Due to a lack of resources, it can be difficult to research topics involving illegal drugs, but some scientists believe there is potential for helping people with depression and anxiety. Whether it's made naturally or in a lab, any drug has the potential of side effects. You will be unable to move and lose consciousness of your surroundings after smoking toad venom. Some people who use this drug will put themselves in danger of being exploited. It's such an intense experience that in most cases, doing it at a party isn't safe, said Alan K. Davis of Johns Hopkins University. It is not a recreational substance. People can white out and disassociate from their mind and body if they are dosed too high. Some experience anxiety and some ended up going to the hospital.
There is a debate over whether hallucinogens like toad venom are addictive. LSD, magic mushrooms, mescaline, DMT, and 2,5,1-NB-OME are all common hallucinogens. These medicines have an effect on the brain by interfering with communication between the chemical systems of the brain and the spinal cord. Mood, sensory perception, body temperature, sexual behavior, sleep, appetite, and gut muscle function are all influenced by this. Panic, extreme perspiration, dry mouth, sleep issues, and psychosis are among side effects of using hallucinogens. Users may have persistent psychosis, which is characterized by persistent mental issues such as disordered thinking, paranoia, and visual mental disturbances. Some hallucinogens such as LSD and PCP have been shown to be addictive, with regular users developing a tolerance to the drug and needing to take more to achieve the same effect. As more people try these mostly unstudied medication, the consequences of smoking toad venom are slowly becoming apparent. There is help available if you or someone you know is misusing toad venom. For help finding a treatment center, contact a treatment provider now. Thank you so much for watching. We hope you learned something.